The procedures she will be undergoing in the next week or so, there are two procedures. First is called a titanium cranioplasty. And I know some of you, if not all of you, will have seen a video that we released explaining some of that. This is, very simply speaking, and Stefan will be able to address any details that anybody wishes to ask us, but very simply speaking, this is putting a titanium plate, a specially made, custom-made titanium plate over the deficit in her skull, which is of this sort of size in the left-hand side of her skull. Clearly this is primarily to offer physical protection to her brain in the same way as a normal skull would. She does still have the portion of skull that was removed in Pakistan in the initial surgery implanted in her abdomen, but the surgeons, in consultation with Malala, have decided that the fitting of a titanium plate is a better long-term procedure than trying to re-implant this bone after such a long period of time, and that's at least partly due to the fact that some of this bone will have resorbed, so the bone won't be as big as it was. So instead of replanting the bone will be removed from under the skin in her stomach and cleaned up and sterilised and given to Malala, who wishes to keep it for as a memory, I guess. The second part of the procedure she'll be undergoing is a cochlear implant. The reason for this is that the passage of the bullet destroyed both her eardrum and the middle ear and the tiny bones within the middle ear that are essential to hearing. So Malala is currently profoundly or completely deaf in her left ear. So after the plate has been fitted, one of the ear specialist surgeons will fit the cochlear implant. Both of these procedures normally would take about 90 minutes. Clearly, particularly the cochlear implant may be surgically more difficult than normal because the surgeon will have to work around the plate and the damaged anatomy from the bullet and indeed previous surgery. We're not envisaging any significant difficulties. As I say, normally we would expect each procedure to take about 90 minutes. It may take a little longer due to some of the anatomical difficulties of previous surgery and previous injuries.